Good afternoon. I'm Dr. Wytch. Like I know some of y'all, some familiar faces out here. I'm with Cardiovascular Associates, and I come to Silicaga every Tuesday, and excited to get to talk to y'all about a heart-healthy lifestyle today. Before I get started, I'm originally from Decatur, Georgia, so I grew up just outside of Atlanta, and then I did my medical school and internal medicine training at the Medical College of Georgia before going to the University of Florida to Shands Hospital to do my cardiology training. And I've been with CVA for almost 2 years now, and like I said, I come down here on Tuesdays, and it's a really enjoyable part of my practice. I love coming in and seeing the community here and being able to provide services both in our office and at Coosa Valley Medical Center, and making sure that y'all don't have to travel too far to get what we would consider really world-class cardiovascular care and access to that care. So the goal of my talk today is kind of broad, just things that we can all do to kind of help our heart health, but also our overall health and our longevity to go along with that, okay? If anyone has any questions, feel free to raise your hand, and then we'll take questions at the end, okay? When we talk about heart health, it is a lifelong action. There's decisions and actions that we take early in our life will have impacts later on. If we choose to start smoking in our teens, even if we quit, in our 40s, that decision's made there. But the same goes true as we get older, that actions and decisions that we make today can improve our heart health now and allow for more physical activity, feeling better, and giving you more time with your friends and family. And I think that's a lot of what I try to do with my practice, is give you good quality time to spend with your loved ones, because that's what we all want. And we all want that to be good quality time and not time where we feel like we can't keep up. So the first step in that is diet. You'll meet different cardiologists, and some people are very strict on diet. I am not, okay? You live once, right? It was Easter yesterday, y'all should have eaten good, okay? The literature around strict diets is not great. These very restrictive diets that people postulate can benefit in terms of heart health. What happens if you go on a really restrictive diet, people don't stay on it. So even if there is a benefit, when they follow these people for longer periods of time, what they find is they don't stay on these diets long term because they're not sustainable, they're too difficult, they're too restrictive. And so what my advice is everything in moderation, right? On Easter, have your Easter supper, okay? But the rest of the week and the rest of the month, we try to maintain a balanced diet. The Mediterranean, I will say the one diet that does seem to have the most evidence to supporting heart health is the Mediterranean diet. And so y'all can look up recipes. There's lots of books and online recipes about the Mediterranean diet. It's heavy in fish and olive oil, lots of beans and legumes and vegetables and fruit. It can be flavorful. This is not, food, Greek and Italian food is not devoid of flavor. It does avoid deep frying, but otherwise it's pretty flavorful. And it compared to a low-fat diet, it showed to have about a third less major cardiovascular events when followed long term. So, and while I'm here, butter's okay too. Okay, I grew up with 2 sticks of butter on the counter at all times. Butter doesn't belong in a refrigerator, and there's been no data to suggest that using butter is problematic in terms of heart health. If anything, using things like seed oils and canola oils and butter substitutes are probably not as good for you as just using plain old-fashioned butter. So and I know in this crowd that's probably a known factor, but that would be my advice on that too. Okay. And then the next thing we're going to talk about is movement, okay, and physical activity. The heart likes to be pushed, and the heart likes to relax, okay? It's important for it to have those different states throughout the day. I have a 5-year-old son, and if he is cooped up, we traveled yesterday. We went to see our family for Easter, and we had a long day of traveling, and when he got out of the car, he was like, he burst out of that cage and was running all around. And your heart will do the same thing if you don't ever exercise it. The first chance it gets to pick up and run, it'll run away from you. And you won't be able to keep up, and you won't be able to sustain that level of physical activity because the heart doesn't have that natural back and forth cycle of getting pushed to a higher activity level and coming back down, right? And so the for all of us is 30 minutes of moderate activity per day. That can be brisk walking, that can be playing golf, that can be, shopping briskly around Walmart. I got a patient who every morning she does 2 full laps around Walmart, and then she walks up and down every aisle, and then she gets herself a treat at the end, and that is great, okay? and it works rain, shine, they're always open. It's a simple thing. There's some other activities that I think, and actually, I've talked with my patients here, and I don't know that we can try to work on. I love water aerobics, okay? As we get older, our joints hurt, okay? That pressure hurts. Walking is difficult. And water aerobics is an activity that takes the pressure off of our joints, but also builds in resistance into those movements. So it helps improve strength and improves cardiovascular fitness pretty dramatically. And if we have an indoor facility, it can be done year-round. And that's something that I would want to work with our community partners on bringing to Sylacauga, because it's a definite need, and it's a really great resource for a lot of people for when your knee hurts or your hip hurts. How do you maintain that physical activity level when a lot of these walking-based activities aren't available for you? And then I put in here the 7 Chinese movements. Has anyone seen the 10-minute Chinese workout? So the Tai Chi. So my wife's grandmother is from Korea. She's 95 years old, and every morning she wakes up and she does her routine. She's up and down, she touches her toes, and it gets her heart rate up, but it also increases her flexibility, her strength, her balance. She lives alone, she walks up and down hills, she walks up and down stairs. And so if you haven't looked at this routine, it takes about 10 to 15 minutes. You can do it every morning. It gets your heart rate up, it builds strength, it builds flexibility, it builds balance. And when we talk about movement, and we talk about heart health, there's multiple benefits, because yes, it'll improve your heart health, but falls are something that we can't have, okay? Falls are what leads to broken hips, and broken hips lead to immobility, and these sorts of things is a slippery slope. And so that physical activity, that building of strength, that building of balance, it helps your heart on a day-to-day basis. That's great for me. But when we talk about living longer and living better, having that strength, having that balance, having that ability to keep up with your family, with your grandchildren, with your children, all really matters a lot, okay? All right. And then we'll start to get into some of the more medical side of it and how you can monitor your health. So we'll start with blood pressure. So the goal blood pressure is systolic below, the top number below 130, and the bottom number 80 or below, okay? And depending on where you are, and what sort of risk factors you have, I would work with you on that. There is literature to suggest that the lower the better. The lower the better. It doesn't matter if you're 45, 55, 65, 75, 85, 95, the lower the better. My experience, I think that we have to be some more lenient with certain patients, but that's a really good goal, is to be below 130 over 80. And my recommendation is to check your blood pressure 2 hours after you take your medicines in the morning. So if you wake up, you take your medicines at 7 a.m., you can check your blood pressure at 9, okay? I got patients who come in, they're checking it 15 times a day, and that's not helpful either, okay? That's not a healthy, you're tied to your blood pressure cuff, and blood pressure has a natural rhythm too. It's lowest overnight. It's supposed to be low. If you wake up, I have patients who wake up in the middle of the night to check their blood pressure. You don't need to do that either. It's supposed to be low then. But it picks up as the day kind of goes along, and then it dips, and then we have another pickup, and then as we get into the evening, it levels off again. So if you're checking your blood pressure at different times throughout the day, it's going to be different. When you exercise, your blood pressure's high. It's supposed to be. So if you've been out doing something physically and you go in and you're like, man, I feel funny, and you check your blood pressure and it's 170 over 100, and you've just been walking around, or pretty, cutting the grass, maybe that's okay. So really it's important to me to have that consistency and to be at goal most of the time. Okay, we're not going to be at goal all the time because it's a dynamic product, okay? Cholesterol. We just had new cholesterol guidelines come out, okay? We have new cholesterol molecules that we are measuring, okay? Depending on where you are, we have different goals, okay? Have you had a major cardiovascular event? Have you had a stroke? Have you had a heart attack? Have you had bypass surgery? Put you in a different category, okay? If you're otherwise doing pretty well, maybe we can be a little bit more lenient. We have some options. We also have some new labs that we can use to better risk stratify folks besides your typical good cholesterol, bad cholesterol that we've known about for a long period of time. So that's a conversation that we would have, okay? But it should get checked annually, and lower is better is generally a well-conceived thought, but I think the benefit of lower is better. It depends on the patient and where they are with their other risk factors and prior history, okay? And then something that I don't necessarily treat as much, but is very, very important for overall heart health is your blood sugar, okay? Keeping your blood sugar in check is very, very important. We know that type 2 diabetes and type 1 diabetes are major risk factors for cardiovascular disease. Having poorly controlled blood sugar leads to inflammation within the blood vessel walls and increases your risk for strokes, risk for heart attacks. And so that's something that we work with our most folks' primary care partners to keep a close eye on, okay? But in my world, it's very important to keep that in check, okay? And so rest and relaxation, recovery, okay? This is important for heart health too. You got to get your sleep, okay? Sleeping 8 hours a night is very important. Like I said, your heart rate goes down, your blood pressure goes down. It takes stress off of your body when you're asleep. And with that, we got to screen for sleep apnea. The risk of uncontrolled hypertension with obstructive sleep apnea is quite high. The risk of things like atrial fibrillation with untreated sleep apnea is quite high. And so that's another thing that we commonly do in our clinic to refer people for sleep studies. If you're married, we ask their partners, do you snore? And that's our first screening test. And some people come in, and I have gentlemen come in, and the wives, they'll say, he stops breathing 6 times a night, and say, let's get that checked out, because that's definitely a risk factor. But being well rested leads into that next bullet point, which is stress. And so if we're under stress all the time, what happens is we have our fight or flight hormones and molecules in our body are come up, and what it does is it increases our blood pressure, it increases our blood sugar, increases our heart rate. And just like we talked about, my 5-year-old bursting out of the cage and running around, if you're in a constant state of stress, whether that's because of your health or what's going on in your life, as soon as you get that little stimulus, your heart's going to run away from you, and you're going to feel that, right? Because it's taking a very little stimulus to push your heart rate up and push your blood pressure up. And so, whether it's breathing exercises, or making sure that your affairs are in as best order as you can, that's all real important, is making sure that your heart has a nice, steady state. And then the last point I want to talk about is like mental health, things like depression, things like anxiety. We have study after study showing that if you develop depression after a major cardiovascular event, you do substantially worse, okay? And I'll share a story. I have a young patient, relatively young in my world. He's in his 50s, but he came and saw me, and he was otherwise healthy. And he was like, I don't know that I need to be here. And we did some testing, and he had a blockage. But on this testing, we also saw there was something in his chest, and so we had brought him in, put a stent in, and we sent him for a separate scan to see what was in his chest. Well, it turned out he had lymphoma too. And so he got treatment for his lymphoma, and then he was doing great. And I was real happy, and then he came back in the office, he's like, man, I got this chest pain again, and his stent had almost collapsed after less than a year. And we were waiting for him to have surgery in the hospital. Things went a little bit south one day. He got to get rushed into emergency surgery. He got bypass surgery, and he's doing good. He came back into the office, and he's like, I don't feel like myself. And I was like, well, you shouldn't. You shouldn't. Like, if you blew all this off, and it didn't affect how you thought about the world, how you thought about your family and your time with them, that would be concerning to me, right? And when we have major cardiac events, it should impact how you view the world. And if it impacts you in a way where you feel it's pointless or there's no point, we need to know that because you won't do as well if that's how you feel. And we have interventions, we have medications and therapy and things that we can do when that happens to try to overcome that. And we know from trial after trial that if we do those things, people do better. They recover faster. They recover from bypass surgery faster if you don't have depression. They get back to their lives quicker. That physical activity level improves, right? You spend more time out with friends and family, which is what we all want to do. So I think that's all real important too, and it's important to bring it up to us if you're having those concerns, okay? All right. Tobacco use, okay? We all know this is bad, okay? Just stop, okay? It's hard. It's really, really hard. But, all the things that we can do, if you quit smoking, that's more than anything else I can do. So if you came to me and you said, I have all this other stuff, and I told you, these are all the things in your lifetime I can do, or you can quit smoking. Quitting smoking will give you a bigger benefit than anything I can do. And so, it's pretty straightforward. Other forms of tobacco, there's still a malignancy risk. There's not as high of association with cardiovascular disease as there is with cigarette smoking. The alternative tobacco, the vaping, the things like that, the jury's still out. I don't feel comfortable giving you yes or no's, this is better or this is worse, because they just really haven't been around long enough for me to say definitively. But for, and the benefit of stopping smoking starts within days. I mean, there's some argument within hours. We see less oxidative stress and less inflammation within the blood vessels. And that benefit, persist. But the same can be said is that, like I kind of open, like that damage that's done when you're in your 20s matters too. So if you have younger friends or family who are smoking, getting them to stop earlier is better. The earlier you stop, never is obviously best, but the earlier you stop, the more benefit you're going to derive from stopping, because that damage, once it's done, once that plaque formation is started, it's there. And so then you kind of get to the point where we have to stabilize it, okay? And then this isn't really something that y'all can do for a heart-healthy lifestyle, but I think it bears mentioning is your genetics. We can't avoid who our parents are. All right, there are folks, and if you come to see me and you say, well, Dad had his bypass at 55, Grandma had a stroke at 62, my brother had a stent at 57, you're in a different ballgame. That we know. I tell folks all the time, I'm not the smartest doctor you'll ever meet, but I'm not the dumbest, okay? And when if everybody in your family is having events, that's something we need to know. Your risk is different. Your risk is inherently different. And that's where some of these new advanced lab tests, we can kind of identify where that risk is coming from. Sometimes we can't. But if everybody in your family is having major events, and especially young, and when I say young, I would say in a man that is a major cardiovascular event, so a heart attack, stroke, needing a stent, or needing bypass surgery before 60, or in a woman, those same things: heart attack, stroke, needing bypass, stent before 70. Those are young. If that occurs in a first degree relative, or frequently in your cousins or aunts or uncles or something like that, that's going to put you in a higher risk profile. And that's information we need to know, and you need to take that into your account of, hey, I have this to overcome because I was born with it, right? If you come to me at, I see these consultations. I have somebody who comes in and they're 82 and nobody in their family's ever had a heart issue. They've never had a heart issue. Their blood pressure's fine. Their cholesterol's fine. And I say, I don't think I'm ever going to make any money off of you, okay? That's the reality of it. Is if you've got good genes and you've gotten that far, there's probably not a whole lot for us to do there, okay? And so it goes both ways, right? If you're high risk, we're going to address it. If you're low risk, we can probably be a little bit more lenient, okay? All right. And then we kind of touched on this throughout it, is partnering with us, is partnering with your doctors, and we're happy to see you when you have a problem, when you want risk stratification. What I'd leave you with is take your medicines as prescribed. trying to figure it out on your own sometimes works, and that's something that we can talk about. But I'd rather talk about it than just you do it. There's a lot of over-the-counter supplements nowadays. Okay, there's a lot of people telling you that this is going to make things better. There's sometimes some interactions there. Sometimes the data on it is not as not a steel trap that we would feel confident in. And sometimes there's interactions with medicines, and sometimes the manufacturing of these things, where they come from, isn't as scrutinized as drugs that come through the FDA. And so that's a discussion that I like to have, and I commonly have folks bring in their list of supplements. And then the last thing that I really work hard to do is to develop an individualized plan. I like to hear what your goals are, right? Is your goal to keep up with your grandchildren? Is your goal to stay out of the hospital? Is your goal to live as absolutely long as possible? And you don't care how you feel, but you just want to be here as long as possible, okay? All those things are a little bit different. And in general, if you feel good, you stay out of the hospital. If you stay out of the hospital, you live longer. That's kind of the way I approach it. But everybody has slightly different goals. And so how we address those goals with your therapy matters. And so that's where, having a conversation with us, discussing your concerns, what your ultimate, what you really want to get out of your life is important, because then we can tailor your therapy to that, okay? And then, so wrapping up here, I say eat well, right? Like, lots of vegetables, avoiding fried foods most of the time, but have a cheat meal, okay? Like it's not gonna make a huge difference, and make it sustainable, I think is the important part. 30 minutes of moderate exercise per day, and spend time with your family and friends. Be social, get out, do things like this. This is a perfect example of like these kinds of activities where we build community, we build purpose. That will help immensely. We know there's an epidemic of loneliness. We know that the outcomes of people who don't have family and friends and support structures are there. And even on the level of like, who's going to pick you up? Sometimes that's a question for people. And so making sure that you foster those relationships with people in your community, it helps, at the most basic level, but it also helps in helping us deliver your care plan, because sometimes you're going to need assistance. And we need those people around you. You need that network around you to be able to do that. And the last point would be to talk to your doctor, optimize your risk, and develop a plan with medical therapy and procedural therapy that works for you and what your goals are. Okay? That's all I got, but I'll open it up for questions if anyone has any.
Guys, do y'all have questions?
Yes, sir, in the back.
Calcium scans or x-rays, how accurate are those?
So the calcium score is a CT scan. We don't use contrast, but what we do is we assess for plaque burden. And so it doesn't tell us if you have a 5, 10, 15, 30, 60, or 90% blockage. What it tells us is that, the way I approach it, 1, do you have plaque, yes or no? And 2, how much do you have? The more you have, generally the higher risk you are. But I have, my next door neighbor scores 3,000 and he does triathlons, right? So I don't think he has high-grade blockages, but he does have a substantial plaque burden. So we use that to guide medical therapy. It's a risk stratification tool. It is not an assessment of do you have a severe blockage or not. The data is fairly well validated, but there are exceptions. We'll have patients who have calcium scores of 0, but they have not calcified plaque, what we call soft plaque, which actually can be high risk. And so it doesn't, if you have a score of 0, your risk is lower, but it doesn't completely absolve your risk. Any other questions?
My mother had a calcified aorta. How did you get that?
So the calcification process of the blood vessels it's kind of like a scar. And so what happens in our blood vessels is there's an injury from, say, high blood pressure, that stretch on the blood pressure, and cholesterol goes in there. And so at that point, we have this kind of fatty plaque that develops. And then as that heals, it heals down and scars down into this calcified tissue. And so it can present some issues in specific instances. Without knowing all the specifics, I can't, but that's generally the process of atherosclerosis is the big fancy word they teach us, is you have vessel wall injury, cholesterol entering into that vessel wall, and then the kind of healing process, it kind of turns into a calcific rock that's there that can present some issues. Yes, ma'am?
Can secondhand smoke affect the heart? Like
Absolutely. Okay.
That's what I'm worried about.
Yeah. Anyone who lives with a smoker, I would suggest they smoke outside.
Well, that's way past.
Yeah.
Younger and
Yeah, but so it's not as bad as smoking yourself, but and there's degrees to it, right? They're smoking in the car with the windows up, and then there's but yes, that is a known association.
I have asthma because of
Yeah.
secondhand smoke, and I'm worried about the heart.
There's a chance.
Any other questions? Okay.
Yes.
Why did you hear it Silicotta?
So I'm with Cardiovascular Associates. I think the number's on your handout there. I come down every Tuesday. Cardiovascular Associates, we're right now 16 doctors. Our 17th is coming this summer, and he's going to be coming to Silicotta on Fridays. We have 5 days a week coverage is what we've been really striving for. And we are doing we're doing our own procedures at Coosa Valley, so that for convenience for the folks down here. So I know last month we did 35 procedures at Coosa Valley, including catheterizations, pacemaker implantations, some specialized imaging procedures, and cardioversion. So we really try to make an effort to serve the community here and keep it local. Obviously, there's some things that we can't offer down here, but for most, 70% of what we offer, we can get that done right down here at Coosa Valley. And so we've been really happy with partnering with Vanessa and Glenn and making sure those service lines are open to us.
All right, fantastic. Let's give Dr. Rigger a hand. That was wonderful. Thank you so much. It always makes me go through that list, and you probably like me, kind of reflect and looking in the mirror thinking, I didn't get up and do no Chinese exercises this morning, did y'all? But maybe tomorrow. It's been very fun. We're so glad. I think I'm right, Cindy. Help me with this. CVA has been in our community well over 10 years, right? Maybe more, yeah, for a long time. But we are so thankful to have some new physicians coming in and really doing the procedures at Coosa Valley, because it makes it easier for you guys. And we have a fantastic cath lab. If you've never seen it, we'd welcome for you to come walk through it. So, and honestly, we have just a wonderful staff there in the hospital too to take care of you. So, just exciting things regarding healthcare and everything else in our community. So thankful, so blessed that we're all here together, working together to make it great. So with that, I'm going to ask the marketing team, who does a great job getting us set up and ready every week, and they're going to come and give away some of your